Autism spectrum disorder is a developmental disability caused by differences in the brain. It affects nearly 1 in 36 children in the U.S. Advances in diagnostic capabilities allow doctors to see more accurately the prevalence of autism. Yet the majority of children still do not receive a diagnosis until age 4.
Early diagnosis of autism is really important because in the first few years of life, neural circuits are the most flexible, and it's during that time period when really important gains can be made to help close developmental gaps.
For Cody, he was diagnosed at 26 months, and he immediately went into what is called an IOP, an intensive outpatient program, which was 40 hours of applied behavioral analysis, ABA. He has come so far. Early intervention is key.
The prevalence rates of autism have been increasing each time the CDC comes out with new studies. And it's vital and it's important for us to understand the reasons as to why. There's a great disparity in our country as it relates to access to healthcare and access to sound diagnostic criteria. We know that autism isn't specific to one minority group or one class of people. We know that it impacts everybody, and we know that it impacts everybody equally. And so when we're seeing that there's disparities, it's our job as clinicians and as a community to be able to shore up those diagnostic rates.
Children with autism have unique strengths and challenges and different treatment needs, so it is difficult for caregivers to find the right services. Autism can impact every aspect of a child's and family's life.
You have to be able to apply what he has learned in all environments. Generalization is a hard thing with autism. And so if he can do it great at his school or at his center that he does his therapies at, he has to also be able to do that at home.
Families who have children with autism require additional support services in their homes and in community settings because children with autism often have behaviors that can be quite challenging for caregivers.
It's vital that we not only identify autism early on, but that we create and develop a sound treatment package that helps to address that individual's unique clinical needs from the onset. This way, it's helping the family, it's helping the school, it's helping the siblings, it's helping the community so that individual can be successful.
Applied behavior analysis is one of the main treatment approaches for ASD that incorporates positive behavioral reinforcement, providing families with hope on a lifelong journey. Magellan Healthcare is leading the way in the management of ASD. With over 50 years in the behavioral healthcare arena and a staff with overwhelming ABA experience, Magellan is unparalleled in this field.
The way in which Magellan is redesigning and redefining the industry is by looking at it from a group design and group outcome level. By looking at that level, we're going to now be able to find a way to tier our networks. Why is that important? Like for all of us who are accessing any kind of a healthcare service, you want to go to the best that's out there. In ABA, we don't have a means or a mechanism to do that. Magellan's Autism Connections program is unique in that it is a team of behavior analysts and licensed social workers and licensed marriage and family therapists that work in concert with the member and the provider on the individual's best practices. At a macro level, we're starting to change the shape in which we look at the field of ABA.
Magellan continually works with researchers, academic institutions, and other companies to identify, test, and implement new diagnostic and treatment programs for ASD.
Our partnerships are important to our program because we know that we can't do everything, and we know that there are experts in our industry who are doing just tremendous and phenomenal work. Their innovation is groundbreaking, and so what we want to be able to do is partner with them. Magellan vets its partners by researching and identifying what the early outcomes are from that provider.
We have a partnership with Magellan that is first of its kind, where we are able to provide a level of care to patients. At CAIO, we call this our ABA Optimized program, and it's a way of providing ABA therapy in a more flexible manner. And at CAIO, our motto is "Make every moment count," and I think that that's representative of both how we think about ABA at CAIO and how Magellan thinks about it as well.
What we want to be able to do is partner with key allies within the autism community to better address the ongoing symptomologies of autism for that individual. And so these key partnerships are essential for that member's success. Magellan is building a different future for an individual with autism and their family so that we can show them, we can demonstrate to them which groups are showing those outcomes. Because a family has a right to be able to go to the best providers that are out there.
For more information, visit www.magellanhealthcare.com/autism.